Which of the following statements regarding spinal cord injury are true? A. In trauma, the most commonly affected segment is the cervical spine. B. Spinal cord injury patient can be evaluated using the SCI scale, which is sensitive outcome scale based on imaging. C. In Brown sequence syndrome, patient experience sensory loss of acute light distribution due to disruption of the both spinothalamic tract. D. Neurogenic shock is associated with spinal cord injury due to interruption of the sympathetic innervation to the extremities. E. Spinal shock is characterized by hypotension and bradycardia. And the answer is as highlighted, and the reason for it. Thoracolumbar junction is more common due to transition between a rigid or stiff thoracic spine to less rigid or mobile lumbar spine. SCI scale is a universal classification tool for spinal cord injuries based on a standardized sensory and motor assessment. Brown sequence syndrome is a neurologic syndrome resulting from hemisection of the spinal cord. It manifests with weakness or paralysis and proprioceptive deficits on the side of the body ipsilateral to the lesion and loss of pain and temperature sensation on the contralateral side. It is an incomplete spinal cord injury. Spinothalamic tract that are responsible for pain, temperature, and crude touch would be affected contralateral to the lesion because they ascend a level up and then cross to the opposite side of the cord. Neurogenic shock is a combination of both primary and secondary injuries that lead to loss of sympathetic tone and thus unopposed parasympathetic response driven by the vagus nerve. Spinal shock is defined as temporary loss of spinal cord function and reflex activity below the level of a spinal cord injury. It is characterized by flaccid, areflexic paralysis, bradycardia, and hypotension due to loss of sympathetic tone and absent bulbocavernosus reflex.